Hello everyone. Welcome to our smoking and smoking cessation during pregnancy PowerPoint presentation for the Maternal and Child Nursing course. In this PowerPoint, we will delve into the nursing surrounding smoking addiction and pregnancy. Here's a brief overview of what we will be discussing and learning today. We will be discussing smoking and defining what smoking is. We will discuss the importance of abstaining from smoking during pregnancy and pregnancy complications relating to smoking. We will also talk about the effects on the pregnancy and the client and the baby. We will also talk about impaired anatomy and physiology, the health teaching relating to smoking and prevention of side effects, diagnostic assessments and nursing assessments one must use when providing nursing care, nursing and client interventions for this sort of situation, community interventions and resources, medications and holistic interventions, and postpartum care to do with smoking.
Smoking, what is it and why do we do it? Based on research, statistics show that most people claim that smoking feels good. They started due to peer pressure, stress or boredom, active rebellion, mirroring their families to what they grew up around, thinking that it's normal, and the ritual is enjoyable. Risks of smoking while pregnant. Smoking in general provides several health risks. Smoking while pregnant doesn't only affect the mother but the baby as well. These complications and risks are preventable and minimized when the habit is stopped. If you look to the right-hand part of the slide, there are a whole bunch of different statistics based on what can happen if you're a smoker while you're expecting. There's facts on postpartum bleeding, SIDS, and a whole bunch of different conditions that can happen. Risks for the mother/smoker. Miscarriage is known to be one of the worst things a mother can experience. It's painful, devastating, and traumatic. Being a smoker increases the chances of your baby being stillborn or having a miscarriage. This is because of the chemicals that are in the cigarettes. Here are some more risks and complications that can occur if you are a smoker while you're expecting. Smoking while you're expecting reduces the mother's chances of becoming pregnant again in the future. It affects the lung capacity and breathing habits. This goes for both the mother and the baby. More likely to deliver the baby early. Normally the baby isn't grown to term. Higher chance of miscarriage, damage to the placenta, which the baby receives oxygen and nutrients through this organ. Ectopic pregnancy, this happens when the fertilized egg implants somewhere not in the uterus, so in the abdomen or fallopian tubes, which that is not where the baby is meant to grow and develop. Placental abruption, placenta previa, this happens when the placenta stays in the lower part of the uterus. This deprives the baby of receiving oxygen and nutrients and can cause excessive bleeding. Here are some complications and risks that can happen to the baby. When the baby's mother smokes during her pregnancy, the baby is exposed to health risks that can be life-lasting. These include weaker lungs/underdeveloped lungs, born underweight or underterm, preterm delivery, the leading cause of disability/disease and death, tissue damage in the unborn baby, which usually occurs in the baby's brain and lungs. Studies show that there's a link between cleft lip and maternal smoking. Quitting smoking is easier said than done. Some women can quit without hesitation once they become pregnant, but it's not always that easy. There are resources for assistance to quit that include medication, placebo effect, counseling without drug treatment, and coping mechanisms to distract from smoking urges.
During pregnancy, the mother's body changes to meet the needs of the growing fetus. The cardiovascular and respiratory systems are under added stress to produce a full-term baby of normal birth weight. If you think about the anatomy and physiology involved with non-pregnant smokers, you know that the respiratory system and cardiovascular system is involved. So when you translate that to a pregnant woman, you can imagine that the new demand for oxygen cannot be met while smoking, and the increased blood volume required for the fetus is not as full of nutrients as it should be. More specifically, smoking causes an increased heart rate, as well as increased blood pressure, and the workload is damaging to the internal lining of the blood vessels. This leads to a low birth weight baby, as the umbilical arteries are being damaged and constricted from the nicotine, so the placenta is not receiving adequate blood flow, and due to a lack of oxygen as the carbon monoxide takes out the binding sites in the blood, the baby is underdeveloped and can have health issues later on in life.
It's very important for pregnant women to understand and know the risks of smoking while pregnant. If they want to quit or don't know how, there are lots of things you can do to support them and help them get to where they want to be. Quitting at any point during a pregnancy will help reduce the risks of low birth weight, but you have the best chance of that by stopping before 15 weeks of being pregnant. Some things that pregnant women should be reminded of if they are smokers. It's never too late to quit, although the later you quit, the greater risk of complications, so it's better to quit early in your pregnancy. Consult the doctor about nicotine replacement options and figure out what is best for you. Not all nicotine replacement options will be good. The baby will be exposed to nicotine through breast milk if you continue to smoke after giving birth. Complications with smoking during pregnancy can include low birth weight, premature birth, loss of baby, or problems with the placenta.
Some nursing assessments that can be done on the mother are to monitor orthostatic, blood pressure, oxygenation, hemodynamic values, and daily weights, to monitor the blood and the oxygen in the blood. You can monitor for dyspnea, jugular vein distension, peripheral edema, tachycardia, and irregular heartbeats, as the cardiovascular system will be impaired. Placing the client in semi-Fowlers or high Fowlers will decrease venous return and load, so the increased workload is a little bit less. Encourage early prenatal care and regular prenatal visits, so the baby can be monitored throughout the pregnancy, as can the mother. Obtain a smoking history, so you know what the baseline is for the mother and how much she smokes on average, and counsel women to stop smoking for the safety of the baby, and give referrals to smoking cessation programs to help the mother through that transition. You can also provide antenatal education. Further assessment can be on the client's perception of health and wellness and major barriers to their health and wellness, as that will influence the way they see smoking greatly. And you can use motivational interviewing to help the client identify and change their unhealthy behaviors. These will help to decrease the adverse effects of smoking on the mother and the fetus during the pregnancy. Some diagnostic assessments that can be done are the carbon dioxide content. So this measures the amount of CO2 in the blood. So you can see how good the blood is at carrying the oxygen. You can measure arterial blood gases. Again, this assesses the adequacy of oxygenation through the body. And you can do a cotinine test. So this assesses the exposure to nicotine on 4 levels. So you are marked as no exposure, passive exposure, abstinence for more than 2 weeks, and active use. Typically this is used for smoking cessation programs or for research purposes, but it can also be used during pregnancy to see how the mother is doing with her quitting smoking.
Medical and holistic interventions are used interchangeably in order to provide the best care for the mother and the baby. Some medical interventions that are used for postpartum women that struggle with smoking are intensive behavioral counseling to help prevent relapse. Nicotine replacement is also recommended as it helps provide goals for the mother to reach and minimizes the lasting cravings of nicotine. Some holistic interventions center around listening and interviewing the mother specifically. The use of the 4 A's, ask, advise, assist, and arrange, is effective as it provides meaningful conversation and begins a safe therapeutic relationship. With mothers who struggle with smoking, a safe therapeutic relationship is mandatory in order to help them succeed with their care and with overcoming their addiction. By asking, advising, and assisting with quitting, this provides specific, patient-centered interventions and ensures that there is a plan in place for the future, not just for the child, but also for the mother. Smoking is an addiction. Therefore, most women who quit during their pregnancy often resume smoking within the first 6 months. The relapse rate for postpartum mothers is around 80%. Smoking is a hard addiction to quit as it affects your body physically and psychologically. It takes hard work in order to quit before the pregnancy and becomes even harder to sustain after a woman gives birth. With the birth of a new life comes new trials and stresses that one did not have before. Stress, the presence of a smoker that lives with you, concerns with a child, being overweight, stress with learning how to care for a child well, finances, women who stop breastfeeding early, and women who stop smoking later in pregnancy find it easier to relapse postpartum. Nurses need to be aware of the stresses one deals with as a new or expectant mother and must be able to address them. They also must be able to reassure the mother as their care and competency to care for the child grows, and to make sure that they know what they're doing to eliminate their stress in their life. There are many resources for pregnancy and smoking cessation that are available in our community. Grey Bruce Health Services in Owen Sound is a wonderful place to get the up-to-date information you need surrounding your pregnancy, ways to help quit smoking, and how one can learn to raise your child right. There are online prenatal classes where an expectant mother is able to learn how to care for her body as the child grows. This provides valuable insight to the single mother and to mothers who do not have access to health care in their own backyard. The Healthy Babies, Healthy Children program is also a great initiative that wants to see young children succeed and become healthy adults. The Midwives of Grey Bruce is also a valuable resource for the mother who values home birth and who needs one-on-one discussion and supports about childbirth. The Ontario Prenatal Program also gives great information about how to raise a child properly and how to care for yourself as a mother. Lastly, the Grey Bruce Pregnancy Center is a wonderful place right in Owen Sound that supplies many mothers in the region who need extra support and who need coaching as a single parent.
Hi, my name is Leanne Hoekstra, and I'm the director at the Grey Bruce Pregnancy Center. Our vision statement is to empower and inspire women and men to make positive and healthy lifestyle choices when pregnant. Many of our clients have obstacles in their lives such as addiction, abuse, and limited resources. We are there to help. We are a nonprofit organization and offer free confidential support to help mothers and families who need guidance and assistance. We are connected to other community resources where we can refer our clients to obtain more information based on their needs. We also have a 24/7 emergency hotline. To tie this into the project regarding healthy lifestyle choices, we have several information pamphlets regarding smoking and addiction and educate our clients on the risks that can occur when smoking and expecting a baby. Many of our clients stay with us for years and return for following pregnancies.